Welcome. My name is Diane. I'm an occupational therapist here at the Guelph General Hospital. I'm also a bundled care navigator. What that means is I help you as a patient having your hip or knee replaced navigate the system. I am your go-to person here at the hospital to answer any questions that you may have and help you get ready and organized for your upcoming surgery. This educational video is done in order to give you some information in order to plan for your surgery and to give you some extra information. So, initially, many patients who have their surgery begin by looking at their lifestyle. Is there any lifestyle changes that you can be making before your surgery? May that be the way you eat, drink, physical exercise. The healthier that you are going into your surgery, the better outcomes you will have. Also, when you look at getting ready for your surgery, there's a couple of things to consider. One of the main ones is equipment. So, for your surgery, you will need to look at getting yourself a cane. If you have stairs that you have to do at home, you will be using a cane to do that. Also, as you progress from using a walker to a cane, once again, you will need this in order to progress your mobility. And how do you measure this piece of equipment? So, what you do is you relax your arm at your side. Wherever your wrist crease falls will be where the handle height goes. So, for this cane, it would be too tall for me. But this walker would be the right height. The reason that we want to measure this way is so that we have the appropriate bend in your elbow and for your shoulder. If it's too high, you will be holding your walker like this and it'll cause pain. Conversely, if it's too low, you'll be stooped over and give back pain. So, you will need a cane. You will also need to either rent, buy, or borrow a walker. Either one of these walkers are fine to have. This type of walker is called a two-wheeled walker, and it has swivel wheels on the front. The way that the brakes work is by putting weight through the top. This type of walker, the majority of our patients are using this type of walker when they leave the hospital. So this walker has brakes that you take off by pulling up or set by pushing down. The nice thing about this walker is that with the four wheels, it's easier to go over different types of surfaces like hardwood or carpet. It's also a nice type of walker because you have a seat with you at all times. And also, if you have to bring things from one room to the other, you can place it here, take off your brakes, and off you go. So either one of these walkers is sufficient for after surgery. What we ask is whichever walker you will be using after surgery, if you could bring it with you here to the hospital so that our physiotherapy team will be able to make sure that it fits you properly and you get a chance to use it while you're here in the hospital before you go home. Other equipment that patients who are having their hips or knees replaced look at renting, borrowing, or buying is something for the toilet. It's easier to get up from a higher surface than a lower surface. So for your toilet, you can get a toilet riser. They come in 2, 3, 4-inch heights, and it clamps onto the top of your toilet. We also would recommend that you get something called a Versa frame. What that is, it's aluminum arms that pop out from behind the toilet. That way, you can reach down and push yourself up or reach back to lower yourself down in a safe manner. The other option for the toilet is a commode chair. It comes as one structure that you place over top of the toilet, which raises the height, as well as has the arms all attached. Patients like this option because it also gives you an opportunity or the ability to have it at the bedside at night, which many patients like to have that option, especially as you're healing for that first little bit. The other thing for the bathroom is your shower. If you have a tub that you're going to have to step up and over into, at one point or another, you will be putting all of your weight on that operated leg. So if you have a tub that you're going to have to step up and over into, we recommend that you get a tub transfer bench. What that is, it's a piece of equipment that straddles your tub. That way, you sit down on the outside and you wiggle across on your bum and you lift your legs up and over the tub while you're seated. It increases the safety instead of stepping up and over. Some patients also get a stool or a chair that is placed in the tub. Once again, it's not because you won't be able to stand long enough to shower, but if you are completing this activity in being seated, you have much less of a risk of falling than if you're standing. Some patients also will get a grab bar that clamps onto the side of the tub. So what this does is it allows you to hold on to something while you step up and over, and it allows you to be safer doing that activity because you have that external source for support. Other pieces of equipment that will be handy for you after having your knee or your hip replaced. Anything long-handled, so a long-handled sponge in order to reach your feet, or a long-handled shoehorn in order to get your shoes on and off. This is called a leg lifter, and what this does is it helps you get your leg in and out of bed. Some patients also find that they can use the other side of their cane in the same manner. So if you are finding that it's difficult to get in and out of bed, either one of those options will help you complete that easier. Another thing that is helpful for patients is this device called a sock aid. What this does, you put your sock on the end of it, you toss it in front, and you pull, and it gets the sock up and over your foot. Lastly, probably my favorite piece of equipment is called a reacher. So what this is, it's like an extension of your arm. So if you think about it this way, you pull the trigger and it pinches up here. The nice thing about this is if you are going to be home by yourself and you drop something on the ground, it's going to be very difficult to do that right after surgery. But if you have this, it's much easier and safer. The other nice thing about this is, especially for those of you having your hips replaced, it helps with dressing and undressing. So if you think about putting on pants or underwear, anything from the waist down, the reacher, you clamp or pinch, you put it over your operated leg first, pull up till you can reach it, let go, and pull it the rest of the way. In order to get it off, you reverse it and get it off that way. Other than equipment, in order to prepare yourself for surgery, we recommend that you take a look at your home environment. Falling, we do not want. So what can you do in order to prepare your home? So, removing any scatter rugs that you have around. Do you have electrical cords that are laying around that could be taped down or taken away? Oftentimes, patients don't think of pets as tripping hazards, although they are. So if you do have pets at home, just be aware of where they are within your space when you're up and walking. The other thing to consider is those heavier household activities, laundry, cutting the grass, bed sheets. How are you going to manage those things while you're healing? Is there family or friends that could help you out? Do you need to look at hired help? Whatever that looks like for you, those are the things that we need you to consider now before your surgery. The other thing for your home is that we recommend that anything that you use often throughout the day, that you keep it or have it placed between shoulder to mid-thigh height. That way, it's easy for you to reach. So if your pots and pans are often kept down low, or your medicine kept way up high, can you put everything on a counter height, table height, in order to make it easier for you to reach? It may not look pretty, but it's not forever. What we're looking for is to keep your house safe for you and make your healing as easy as possible. The other thing to consider when going home is that you're not going to be able to drive for the first little bit. So how will you get to your doctor's appointments or your outpatient physiotherapy appointment? Who can you ask, or do you need to look at hired help in order to complete these tasks? Getting in and out of a car can sometimes be tricky after having your hip or your knee replaced. Some tips and tricks that patients have told me over time is push your seat back as far as you can. Give yourself as much leg room as possible. Opening up the backrest of the seat, once again, giving yourself as much room as possible. Like getting on and off the toilet, getting in and out of a car from a higher surface will be easier. So some patients will put pillows, towels, rolled up blankets to raise the height of the seat. Some patients have even said that putting a garbage bag on the seat reduces the friction of getting in and out. If you do choose to use the garbage bag, please remember to remove it before driving away, as it has been told that insurance will not cover you if there is an accident and you're sitting on the garbage bag. The Bundled Care Navigator will call you before surgery and help you organize some of these things with you. One of the things that the Bundled Care Navigator will help you with is organizing your outpatient physiotherapy appointment. Physiotherapy is very important to your healing, and it is very important to complete the exercises after surgery and to attend your outpatient physiotherapy appointments. When the Bundled Care Navigator calls you, we will help you set that up. Also, patients often ask, what can I bring to the hospital? The one thing that we ask is to leave as many valuables as you can at home. Cell phones are permitted, so you are able to bring that if you'd like. And, excuse me, as well as if you own or use a CPAP machine, to please bring it to the hospital, but you do not need to bring the distilled water, as it's available here for you. What we ask that you do is also bring a good pair of shoes. And what I mean by that is something that has a non-slip sole and that stays on your foot, and you don't worry about it coming off when you are walking. So what we want you to be able to do is take a nice, natural step and not have to worry about your footwear but that you can concentrate on working with the physiotherapist on your mobility. Everything that I'm talking about is available in these booklets, which will be given to you at your surgeon's office and available on our website for you to print off as well. On your day of surgery, when you come to the hospital, you will register at the preoperative clinic. Once there, you may be asked several times what your name is and why you're there. It's not because we don't know. It's part of our process throughout the day to verify that we're doing the correct thing. In the pre-op clinic, you will get ready for surgery, and surgery is approximately 1.5 to 2 hours, give or take. After surgery, the surgeon makes every effort to call your contact person to let them know how surgery went. After surgery, you are brought to the recovery room. Once you're stable, you are then brought for an X-ray of your knee or your hip, and from there, you are brought to one of our surgical floors, either 5 West or 6 West. You will stay 1 night in hospital with an expected discharge the next day. While you are here with us, you will see a physiotherapist. That physiotherapist will teach you things like getting in and out of bed and on and off a chair. When getting in and out of bed, you want to approach the bed at a slight angle so that you are facing slightly away from the head of the bed. You will set the locks on the walker and reach back for the bed. You lower yourself down and wiggle back as far as you can. From here, you can help your leg, your operated leg, into the bed, and the other one follows. You then can go down on your knee or your elbows, bend your knee, and use your good leg to help wiggle your bum across and lower down. In order to get out of bed, you want to start bringing your legs off the side of the bed. Once again, you can bend your knee to wiggle your bum across the bed as much as possible. You then get up on your knees or your elbows, legs off, and push yourself up. The physiotherapist will be able to walk through that with you, but it doesn't matter which leg is operated versus which side to get in and out of bed. Practice at home with your setup and let our therapists know if you're having any difficulties. The physiotherapist will also make sure that you're able to walk a certain distance before going home, that you're able to do the stairs if you need to. Our team makes sure that you can toilet yourself, get on and off a chair. If all these goals are met with our therapy team, we let the surgeon know, and then the surgeon will give the okay for you to be discharged home. In these booklets, you will find a set of exercises. These exercises are designed to be completed after surgery. Some patients do begin these exercises before surgery in order to strengthen the muscle around the knee or the hip. Once again, the stronger that those muscles can be going into surgery, the better for outcomes afterwards. The physiotherapist will complete those exercises with you here in hospital, and at that time you can have your questions answered. For those of you having your knees replaced, make sure to purchase your Cryotherm cuff down at the information desk. It is purchased here at the hospital and left at the hospital until your surgery. After surgery, the cuff will be on your knee. It comes with 4 ice packs, and make sure you have all 4 when it's time to go home. The other thing that is available to you is something called the Game Ready. What this is, it's a machine that you are able to rent. This machine circulates ice cold water through the cuff, and it's available if you have your knee or your hip replaced. Science showed that with the ice cold water circulating, it penetrated deeper, which gave better pain control and better control of swelling. This rental is a little bit expensive at $500, approximately $500 for 2 weeks. Some patients choose to pay out of pocket, some use insurance, and others choose that this is not something for them. Whichever you choose is fine. We work with whatever you choose, but the cryotherm cuff for the knees is something that is required. As a bundled care navigator, when I call patients after surgery to see how things are going, some of the information that I get from our patients is that they are surprised at how painful the surgery is. I do not say this to scare you, just for you to be aware that this is an operation and it is painful, especially for the first few weeks. That being said, taking pain medication as needed and using your ice on and off will help with the pain control. The other thing for your group of patients who are having their hips and knees replaced is that constipation is often an issue. When you are not mobilizing or moving around as much as you normally do, when you are taking pain medications and potentially not eating or drinking as much as you do, constipation does become an issue. What we do recommend is that you have some laxatives or stool softeners on hand. That way, if you recognize that this is something that's becoming an issue, you are able to start treating it right away. I have had patients had to come back to hospital because of constipation, and having laxatives or stool softeners on hand does help with that. So, in a nutshell, that's a little bit about information about what to expect in order to prepare and for after surgery. You will receive a phone call from the Bundled Care Navigator where you may ask any additional questions. But for now, thank you and take care.